So, hi everyone, it's great to have you with us. Welcome to the first session of our new webinar series, 10 Talks, short talks, big ideas shared locally. So over the next 25 sessions, we'll be bringing together inspiring speakers, fresh perspectives and practical insights that you can actually use. I'm Carla Romaitis. I'm the workforce lead, also known as the Director of Joy. I'm from the Cheshire and Merseyside Training Hub. And for those of you that don't know us yet, we're all about attracting, growing, retaining the workforce in primary care. A huge challenge because we've got one of the biggest ICBs in England. I'm going to be your host throughout the series along with my colleagues. I'm also joined today by Kerry Corse-Cadden, who will be facilitating our question and answers and supporting the session if any issues arise. The session is being recorded and your microphones will remain muted, although I know it's going to be really tough for you when wanting to ask all those questions to our guest speaker today. However, the question and answer will follow the 10-minute talk, so please use this function on your screen to engage with our speaker today. So I'm thrilled to introduce Clare Howarth. Clare is the head of the North for Diabetes UK. Always gives me Game of Thrones vibes, that Clare, I'm not going to lie. Head of the North for Diabetes UK and brings nearly 30 years experience across health and social care with a focus on sexual health, of course, diabetes and patient experience. Not only is Clare passionate about tackling health inequalities, but Clare's work in Knowsley to reduce disparities amongst young people have earned her a Municipal Journal Award. And very well deserved too. So the topic for today is better together, and what a perfect way to launch the series. So let's get started. Thanks for being here with us today, Clare. Can you briefly describe the role that Diabetes UK plays in supporting people with diabetes?
I can, and thank you so much for having us here today. It's lovely to see so many faces over what I imagine is a busy lunchtime. So our role. So Diabetes UK is the leading charity in the UK, the largest of its kind. That is dedicated to supporting everyone with all kinds of diabetes. So there's over 18 different kinds of diabetes. It isn't all just type 1 and type 2. There's lots of different kinds. And we look at people of all ages. In fact, people even before they're born with gestational diabetes in that retrospect. So we've got a massive research team. Well, smallish research team, but do a massive amount, should I say. And they work tirelessly trying to find a cure for diabetes. And while they're trying to find a cure for diabetes, they're trying to improve care with science all along the way. So smarter insulins, looking at what beta cells are doing, looking at COVID and diabetes together. So while the main aim is, of course, to find a cure, it's also about improving the science on the journey. And then alongside the brilliant research team, you've got our policy and our regions and nations teams. And so we're there to advocate at every level and lobby all of the local governments across, so all 4 corners of the UK. And we do that on a national and a local footprint. So we work with local MPs, we work with national MPs, we work with councillors, we work with ICBs, we work with everyone we can to make sure that diabetes stays firmly on the agenda. And then we offer a massive movement of volunteer and mobilisation programmes, patient engagement programmes, and a dedicated helpline that's there for people living with at risk or working within diabetes. So we're always only a phone call away.
I've seen the tribe of volunteers, that infamous bright blue shirt,
Yes.
and how proud they are to wear that as well. So, I mean, fantastic. The spread in terms of what the work that you do is unbelievable. What do you think some of the biggest challenges currently facing diabetes management in Cheshire and Merseyside are?
Okay, so that's a tricky one because you said before to call yourself, it's a big patch, and it is a big patch. In the north of England, have got 7 large ICBs actually. But for Cheshire and Mersey at the moment, for me, I think I'd highlight 2 key challenges. So the first would be patient activation. I'm not sure everybody living with a diabetes diagnosis knows how serious that is. If they do know, they might, I don't know, they might be fearful of that. And if they don't know, they might think, a lot of people have diabetes, it's not so bad. So I think we need to do more to make sure people know diabetes is serious, but it's manageable and you can have a really good quality of life if you receive the right care. And then I would say that brings me to the second part of that biggest challenge, which is the need to translate that activation into improved uptake of care processes. So there are 9 pieces of care that we're looking at, from eye screen to foot checks to A1AC to blood pressure to smoking status. All those things we know, if they can be done, they're absolutely vital to improving someone's life with diabetes. And again, that's any kind of diabetes. And so I suppose the big challenge is patients aren't always activated. There's still a massive cost of living crisis going on. Patients can't always make time to get to these appointments. And for our HCPs, it's actually really hard to get these up and off the ground and get patients in. So I would say they're probably the 2 biggest pieces of work we've got to do. We are running quite a little way below the national average if you put all of our data together for Cheshire and Mersey. But sometimes it's just about chasing one care process. Normally, the urine test is normally the one that if we can get that right, we start to see things go up. So again, yeah, that would be my big challenge would be care process uptake and getting it above national average.
Fantastic. I know we've got quite a few questions that we were going to talk through, but I'm just going to skip a little bit ahead around to what are sort of the resources and tools do Diabetes UK offer, and how can primary care teams get involved in that if they might not be aware of some of those tools?
Yeah, no, it's brilliant. So we've got, I would really say our helpline is absolutely fantastic, and it is there for everybody. It's there for patients, for carers of patients, for healthcare professionals. We have a clinical team that the helpline can put you through to. So again, I think that's a really fantastic resource and shouldn't be overlooked. We've got a fantastic website. It's both patient facing and healthcare professional focused. What Tom and I always say, and Tom is on the call, Tom is our go-to. He works between all of the NHS systems. We always say, even we struggle to find some things on there, but they are there. So if you can't find them, we'll find them for you. Just give us a nudge. We've got brilliant programs like our clinical champion programs, which can really help people in primary or secondary care if they want to move into that leadership space, or if they're in the leadership space, maybe finding some things a challenge. And then we also mustn't forget our award-winning Learning Zone, which is an online education platform for people living with type 1 or type 2 diabetes. And it's really great because it's quite personalised. So when the patients go on, they put in when they like to learn, what kinds of diabetes they've got, what the learning style is. And then they can go on that from the phone, from the laptop, from a tablet. They can do it on the bus, they can do it in bed overnight, but it's all accredited and really good. So yeah, I would say they're our main things.
That's fantastic. I suppose the final question, because 10 minutes is just rapid, is so how can GP practices, community health teams, primary care staff engage more closely with Diabetes UK services? And I suppose just to tag on top of that is, what's your hope for the future as well? So how can they engage, and what's your hope for the future, Claire?
So engage us, but I think Tom is busily putting stuff in the chat. So just reach out via an email, via a WhatsApp, via a phone call. We'll always come back to you. In terms of my dream, I would love to see some of the things that have worked well across other parts of the north come over to Cheshire and Mersey. As you can tell, I'm a local resident myself. So I would love to see our one-stop shops that we've delivered in partnership in the northeast. That's bringing people in and getting everything done in one hit. It's beneficial to everybody, the HCPs and the patients alike. I would love us to get some momentum around Diabetes Prevention Week, Diabetes Day. Those little moments in time are often where we can really hook people in and get that motivation. And I suppose, good care, health, good patient empowerment happen when our hearts and minds unite, and we're here to unite. So if you need us, please just call.
That's brilliant, Claire. I mean, that brings us to the end of the recorded part of today's session. I can't believe how fast it's gone. Thank you so much, Claire, for your insights, making some really, serious points. Diabetes is serious, and how we can actually work closer together. There is a vast amount of stuff in the chat that Tom's put in there, and really helpful for you today, to reach out. We'll make sure everyone has your contact details. The amount of support available, is just phenomenal. I'm sure our audience has some ideas, some reflections, and some questions. So we're going to move on to question and answers. I'm going to stop recording here so we can have a more open conversation. Please feel free to put your questions into the Q&A. And if you haven't already, you might see one and you can upvote it. The session will be uploaded to our website for those who've missed it. And the details, as I say, will be found online. So I'm just going to stop recording.